Good afternoon, and thank you everyone for attending today's webinar, IT Security and Compliance, The Essentials, presented by Nelson Gomes of Priority One Group. Please be aware that there will be a question and answer portion today at the end of the webinar. To avoid frequent interruptions during the webinar, please type your questions in the question box located on the right of your screen. They will be answered in the order received during the question and answer portion. Additionally, an electronic version of this presentation will be emailed to all participants following completion of today's webinar, and a recorded version will be available on the website for members only. Again, NJMGMA would like to thank you for attending, and I will now turn things over to Nelson.
Good morning, and welcome to today's webinar. Today's webinars, we're going to talk about IT security and compliance, the essentials. So for those of you who have attended some of my past webinars, you'll know that I'm really into comedy. So here's today's little cartoon about a mom talking to her, looks like 12-year-old son about giving back their credit card numbers. So this is kind of the world we live in, where cyber crime is a growing epidemic, and healthcare is one of the big targets. So for today's webinar, there's a couple of goals that I'd like to go over. So we're going to understand the 7 layers of security, identify top patient privacy and security concerns. We're going to discuss some of the common compliance and security errors some groups are making that we're seeing. Provide practical guidance for maintaining proper IT security. Also going to share some simple security measures that you should have in place. So here are some of the things that we're seeing. As of last Friday, we learned about WannaCry ransomware attack that affected over 200,000 users. I think the number's growing in over 100 countries. It's made a big impact over in Europe and in Asia. There are some remnants here in the U.S., but not many, which is good news. But it's a common theme. Ransomware seems to be in this day and age one of the top issues that we're seeing in cybersecurity. So with that said, I want to spend some time on ransomware, and I'll go through some information. So what is ransomware? So practically it encrypts files so you can't reuse them. What you'll see is, you'll see the files there, but you try to click on them, it's going to, and you just can't open them because they're encrypted. And it also spreads where it sees any network shares, anything that it's shared on the network, and it's going to take those shares and encrypt them as well. And then if you want to decrypt them, it's going to ask you for a ransom. So depending on the type of ransomware that you get, we've seen some that the ransom, the longer you wait, the higher it gets. We've seen some that are a small number. We've seen some others that are large. So there's many different strands of this type of malware. For those of you who know me as well, I'm also big into statistics. So I wanted to share some of those statistics with you to give you an understanding or a feel for how this impacts every day. So less than one in 4 ransomware incidents are reported to authorities. Technically, especially in healthcare, if you are on the receiving side of a ransomware attack, you are supposed to be reporting that back to HHS, and technically you don't have to, but you should be reaching out to the authorities, and especially the FBI, who is an entity that is really looking into this and has their own division within cybercrime. So it's definitely something that if you experience it, you should be talking to the feds or having your IT company talk to them and let them know what's going on. 42% of affected users pay the ransom. So, which is not something we suggest or anybody would recommend for you to pay it, because that makes you just a target once again. 1 in 4 who did never recover their data. So even though some people paid for the ransomware, they went back and it didn't resolve their issue. So here are some of the more numbers. So in the grand scheme of things, in the different industries, we're seeing that healthcare's 38% is the high number of attacks are around healthcare, and then you see all the other numbers in all the different industries, but healthcare is in the top 3. So here's a recent post from the USERT, from the United States Computer Emergency Readiness Team, and they're showing how it's important to employ a data backup and recovery plan for all critical information. So any of your mission critical applications, whether it be your EMR, your practice management system, if you have a PACS system, any of the financial programs that you're using, those systems need to be backed up, and we need to be backed up regularly. And you have to have a plan in place. Backing up is not the only solution. Because what we're seeing is, depending on how often you do your backups, that some of those are getting encrypted. So when you try to restore, you're restoring data that's encrypted. So it's having backups and what kind of backups and the multiple of times that you're backing them up. So we'll get into that a little bit further in the discussion. So the numbers. Let's go back into the numbers. Here's some statistics from Q1 as far as breach are concerned, and what they're telling us is that, as you can see, there's a growing number of these statistics as it refers to breach. And if you see in the second graph in blue, 28% of it is hacking, and 44% is insider. What that means, it's something that somebody inside did, or somebody that internally triggered something to happen, whether it was through an email or was it through a website. 21% is lost in theft, and then 8% is unknown, which can be a matter of hardware failure or other things outside of theft, hacking, and insider. The next one on the right shows the pie chart, gives you an indication that 84% in healthcare are breaches are providers, which is somewhat worrisome. Others are health plans, so you have the large insurance companies that are also being attacked. And then some numbers below as far as theft, types of incidents by patient record volume in March, gives you that kind of an indication of how serious the breach continues to be. So one of the things that you continue to see as well is third-party breaches. So as a business associate, they're also responsible for a high number of the breaches incurred within healthcare. So 30% of breaches reported on the HHS website, which is the Wall of Shame. I'm sure some of you have had an opportunity to go there. And I do encourage it, and I have a slide that has the link to it, where you can actually look and see by state and filter by state. You can also filter it by, if you want to see all, or if you want to see covered entities or business associates. It kind of breaks that down. 35% of breach records, approximately 4.5 million records, were due to breaches involving third parties. What does that mean? So whether it was an IT company that was monitoring or maintaining the systems and wasn't doing a good job at it, that caused it, whether it was a EMR or practice management vendor. So those types of third parties are what they're talking about. Or if there's a third party, could be also if anyone is doing any auditing, that they come in and somehow compromise your systems. So there's a influx. It seems that this is also an issue within healthcare. For the first 8 months of the year, insider breaches and external breaches were equally frequent for third parties. Incident involving third parties resulted in 27% more in breach records. So what this is basically saying is it's important that any third-party vendors that have access to your PHI should have and maintain the same guidelines as you do, or you should be holding yourselves to as far as security is concerned. So when you have third parties working within your systems, just be sure to hold them to the same standards that you're being held to. So the stats tell the story. This is straight from the HHS website, and this is giving us a view of cause of breach by number of incidents. And this is an old, from 2015, the 2016 numbers are still being, or haven't been published yet at this point in time. But if anything, there's a bigger growth on the hacking side of things and unauthorized access and disclosure. Those are the two big areas. As far as the type of media by the number, so the media is saying if it's, whether it's hardware-based or if it's film or paper, and we're seeing a growing number of laptops, and any of those mobile type of devices, should be encrypted. That's a no-brainer. Regardless if there's any PHI on them or not, it's just a good practice, a standard practice that should continue. Is any mobile device should be encrypted. You're seeing, desktops and network servers are also equally in those higher numbers. Surprisingly, I think everybody supplies paper and films is also still a threat. So take that into consideration as well. So 91% of healthcare organizations report at least one data breach over the last 2 years. So that tells me that several of you on this phone call have had some type of breach, which is scary. But we're seeing more and more adoption of security measures, which is a good sign as well. Cyber attacks are to affect 1 in 3 Americans this year alone, and it's going to cost us, about $6 billion, which is an astronomical number to consider about, the impact financially, not even in healthcare, but as a whole. So medical records are worth 10 times more than any credit card number on the black market, and I'll explain to you why. If somebody gets a hold of your medical record, it's much easier to do identity theft than just have your social security number, because now they have your address, they know how much you weigh, they know any medical issues that you may have, they know your blood type, they know your height, they know your weight. So that's why medical records are worth 10 times the amount of any other type of data that's out there. And everybody is a target. So medical fraud, these are also some numbers that we're getting from third-party agencies, that it's on average costing $13,500 and up to 200 hours of work to rectify it. And there's a lot of work that gets put into it. And understand that if you do get breached, what happens is now you have to notify, and if 500 records or more, now you have to go through and send those type of notifications to all your patients. All of them need to get a letter to say, we've been breached, here's what happened, here's what we're doing about it. So there's costs incurred in having to do that in a timely fashion. So those are some of the costs you need to consider, not just fixing the issue. Here are some more stats. This has to do with cause of breach by number of affected individuals, and the media by the numbers. Also wanted to show you that 73% have to do with hacking or an IT incident. As I mentioned in my last slide, data breaches are costing the healthcare industry $6 billion annually. So it's a pretty big number. More than 15 undercover entities on the HHS Wall of Shame, and there's the link to it. Or you can also go to Google and just type in HHS Wall of Shame, and it will come up. So I've given you some of the numbers, possibly scared some of you a little bit more. Well, let me go into the different layers of security and what they mean. Physical. So the actual physical piece of security. You know, the data storage, the data centers, the location where you're keeping all your servers. Also biometric or any other keyless entry type of access control that you currently have. So that's the first layer. Second layer is your network, so business class, enterprise grade hardware. So your infrastructure, your firewalls, your SSL, VPN, dual factor authentication, intrusion detection and prevention, and threat management response. So this has to do with the network. So that's layer 2. Layer 3 is the application. So in your case, in the healthcare space, whether it be the practice management system or the EMR, but not just the data on the servers, but the data in transit. So that's the third application. The fourth was the server, so it's the integrity of the file monitoring itself, the patching of those operating systems, and security. The event management, so, you know, a collection of all those events that are happening in the background on that server. And the applications also do that, where they do audit logging and event logging on a regular basis, so you have that information. It's important to be able to keep that somewhere to be able to go back to it. So data, the data itself, backup, at rest, and transit, encryption, retention, archiving. Layer 5, layer 6 is the devices themselves, so whether they be mobile devices, medical devices, or whether you bring in a tablet. 7, obviously, the users, having two-factor authentication, social engineering, policy related to passwords, and corporate policy on different policies as far as using your own cell phone or bringing laptops from the outside. So those are the 7 layers of security. I'm going to go into a little bit more detail. Here is the patient perception. Here's some inside information that we got from the ONC regarding patient perception of health record and privacy and security. Quarter of American adults indicated that they were very confident, and approximately half indicated that they were somewhat confident in the privacy of their medical records. So, you know, they were asked how confident they are with their physician practices keeping their information secure. So this is a result of that. More than 12% of participants withheld information from their healthcare provider. That's a pretty disturbing statistic, in my opinion. I think, and you know, it's one of concern, because if they're not sharing all the information, then how are doctors are being able to treat the patient properly if they're holding back? More than 59 expressed concern about the security. So that's an alarming number. Adults who report a high quality of care have significantly greater confidence in the privacy and security of PHI. Adults with higher implemented value have significantly greater confidence in privacy and security of medical records and less concerned about sharing health information. So it goes back to educating the patient. Individuals' perceptions of whether their providers of EHR was not associated with specific privacy or security outcomes. So it was more of a confidence level with the practice. So here are some of the common security gaps that we see. No risk assessment. So the first thing, if anybody should be doing is and you're required, is to do a risk assessment of your environment, so that you can have a clear understanding of the state of your environment. If there are issues and gaps, and how do you address them? So those are some of the things that we're not seeing. I know that's the first question that we ask, is do you have a risk assessment? And that'll be the first thing that if you happen to get investigated, those are the first things they're going to ask you is, do you have a risk assessment? And that's directly from the Office of Civil Rights, who does the investigation. That's the first thing they're going to ask you. Like lack of safeguarding data and authorized individuals. So we see sometimes what we call a free-for-all, that everybody has admin rights to everything, and there's no layers of security within the users, which is troublesome. Monitoring controls the key systems and check for inadequate logging. It kind of goes in hand with the lack of safeguarding, where you have everybody that has access to everything, but at the same time, you need to be able to ensure that there's monitoring of who has access to what, so that you can adjust accordingly. Create a strong vendors management function. So having an understanding of your vendors that have access to PHI and what they're doing and what they have access to and what they don't have access to. Again, any of your EHR and practice management vendors should not have full access to your servers. They might have access. They need full access to the application itself and how to manage it and maintain it, but to the systems they don't require. And sometimes, again, we go back to making sure that the vendors, if they need that access, that they explain to as why, so that you have it documented. Non-existent business continuity incident response plan. This continues to be an issue that we see, as there is no plan in place. It's, well, my IT firm has the plan, and you shouldn't just rely on your IT firm. There are other aspects of business continuity and disaster recovery that you need to take in place that the covered entity is responsible for and should be documented. So if you have an outage, what are the next steps? What do you do as far as an organization? How do you contact your patients? That type of thing. So some of those need to be documented and should be followed, and should be a plan that also includes IT. Deficiency in technology standards is another area of concern, and the gap that we see is older hardware that are in place, systems that are in place that haven't been updated or that are out of warranty, whether it be a firewall that doesn't have the latest and greatest firmware, that may be vulnerable and that's out of warranty, or whether it be a piece of hardware where your systems are being stored that have hardware failures and nothing is being done about it because they're older systems and they're out of warranty. So that's a standard that we're seeing. The same thing with the desktops and the operating systems, where those things need to be considered. Lack of encryption, and I go back to, this is more pertaining to mobile devices. It should be a standard. It's a no-brainer that if you have a mobile device, it should be completely encrypted, and make sure that you have document to prove that it is encrypted. And user awareness and training. This is a big one. We've noticed that the trend is growing where users are being trained more with a lot of the different tools that are out there, but it's still an issue, and it has to do with educating the end user of what to look out for, what are some of the things they should or shouldn't be doing. So it's a common theme. So having some kind of end user training is definitely a must, and should be part of your ongoing training of your employee. Common compliance gaps. Again, the risk assessment, non-existing HIPAA training for the staff, where they go through a series of questions that they can go through and answer, so that you have some kind of documentation that confirms that your staff has gone through proper HIPAA training. We do it here on a biannually, so twice a year. Our staff has to be fully trained, and they have to pass a HIPAA course that we do online. So that is a requirement. Outdated policies, for having some of your compliance policies as it refers to HIPAA, them being out of date and not keeping up with them is also a gap that we're seeing. However, we're seeing that there's a lot of tools out in the industry that are helping with this, where a lot of those policies are already part of it, and what they do is they incorporate the training with it as well. So it's kind of a one-stop shopping where all that information sits in one location, and as new regulations and policies change, it updates those policies, and at the same time, it updates the content in which your employees and your staff are going to be trained so they become more aware. Inappropriate access to PHI. Again, this is where it's important to identify each of your staff members to understand what exactly they need access to throughout your network. Obviously, if you have an admin assistant, they don't necessarily probably need access to PHI, so they shouldn't have it. Or you'll have different layers of access to the PHI, and it's important to have a standard to go by. Not everybody should have access to everything. So it goes back to identifying and setting standards within the organization to say certain people have certain access, whether it be a category of the function of the employee, whether it be a nurse practitioner compared to somebody in billing. Not, those two should have access to the patient information, but in different levels, right? So ensuring that you're doing that is very important. So auditing that on a regular basis is important as well. And I can emphasize when you do any of those audits how important it is to document all of that. And I go, no documented security program. So having something documented to say if a breach happens or if information is dealt with in a certain way, what are the next steps? So having a guide that provides some information on how to do that is very important to have in place. Trying to keep up with regulatory requirements. This is a tough one. They keep changing, and unless you have somebody on staff that's on top of this, it's really tough. Again, I go back to some of the third-party tools that are out there that help you with this. So I highly recommend it. Something that we use internally to make sure that we're on top of the latest and greatest regulatory requirements. For non-existing agreements with business associates, my biggest takeaway from a seminar that I attended several years ago was just because somebody signs a business associate agreement doesn't mean they're compliant. Anybody can sign the agreement, and that doesn't mean that if they sign it that now the liability falls on them. Ultimately, the covered entity is liable. So you need to ensure that those business associates that you're working with, whether it be IT, whether it be backup, whether it be your EMR or practice management vendor, they have to follow the same guidelines that you're implementing. Emails, text messages, and social media posts with PHI, obviously, that's a no-no. And unfortunately, we have seen in the past where people are sharing some of that information in social media. No designated privacy officer. There should be somebody designated as the privacy officer, whether that person is the full function or not. If they're if you're working with a third party, that would be the primary contact person, but there should be a designated privacy officer. Okay, so here's some common myths about security and healthcare compliance. No one will ever check us. That's for the hospitals and the large practices. I can tell you, if you take a look at the HHS Wall of Shame, you'll see that that does not apply. This applies to everyone. and enforcement has grown. We're seeing that enforcement of policies and enforcement of ensuring security and compliance is growing. I have a signed BA from my vendor. Like I said before, just because you sign doesn't mean that that you're free and clear and that vendor is now held liable. You are ultimately, as a covered entity, liable. So if you do have associates, business associates that are touching PHI, make sure that not only do they sign the business associate agreement, that they have some kind of guideline. Ask them for it. Just straight up ask them, can you please give me or show me or share the HIPAA guidelines that you're following. My hospital is HIPAA compliant. Just because your hospital is HIPAA compliant and maybe you're working with a hospital or you're under the hospital umbrella, just ensure that you are following HIPAA security and compliance, and that you have your own in place. You may fall under their umbrella, but make sure that what applies to them and what applies to you as a covered entity are two different things. Texting patient information is okay. No, it's not okay. There are, again, third parties out there now that have the ability to do it, which are apps that actually we're seeing some of that integrate with the practice management and the EHR, where some of that information needs to be texted to a patient or to somebody else, that it can be done in a encrypted fashion. So to say that it's a patient texted information is not okay. It's not going to happen to me. I would 100% tell you that don't go by that because the numbers don't lie. It's growing, and if you don't protect yourself now, it could happen sooner than later. So what can you do? So the first thing I'm going to say is conduct a risk assessment. Have somebody conduct a risk assessment. Understand where you are. That risk assessment should give you several things. One, it should give you an outline of what you have in place. It should identify the gaps that you have, and with that, you should have some kind of a remediation plan in place that says these are the issues that we found. Here are the gaps. Here's what we're going to do here's what we need to do to address them. Here's when we're going to address them. Here's how long it's going to take us to address them. So if you ever get, if someone comes in and to do an audit, and you need to be able to provide that information. And your penetration testing, this should be part of your yearly tasks that have to do with security, is that you have someone perform a penetration testing from the outside. So someone's going to try to ethically hack from the outside to break into your systems, and that should not be your IT firm. It should be a third party. We do that for our clients. However, we have a third party that certifies that what we did was proper, and they actually go through it themselves as well. So we have a third party go through it and certify it. Quarter vulnerability scans. You don't have to do it quarterly. We do it quarterly to understand internally, do vulnerability scans on your systems to see if you're up to date and what the risks are, so that you can, again, come up with a game plan on how to address those risks. So whether you do it once a year or whether you do it, quarterly, that's all entirely up to you. But it's highly recommended that you do it at least twice a year. Web filtering. This is also important, and in many ways it can save you from going, or your staff going to certain sites that they're not supposed to be going, that can compromise or your organization, whether it's a breach, whether it's malware, whether it's ransomware. There are web filtering products out there. With our clients, it's part of our offering. where we scrub all the data as far as internet traffic coming in and out, and we can set different security boundaries for groups to say, okay, give this group, let's call it the nurse practitioners, full access, but it's also going to the internet, but it's also going to monitor where they're going, and we can categorize to say certain categories we don't want them to access, and if they try to access them, it's going to report back. So you have a way to report back. You know, whether it's streaming music, what some people are doing, that affects your internet connectivity. So it's not really in this case, it's not a security thing, but it's more of a performance thing. So having those measures in place are important, and web filtering is definitely one of them. Conduct security awareness phishing campaigns. So this is also part of our security bundle, something that we do with our clients, where we create phishing campaigns where we're sending out emails to all the users to certain organizations where we're going to try to identify if they're going to click on these emails. Obviously, they're masked as something else, and I can tell you that on average, 40% of our users are going to those emails where they're not going to. This campaign then gives us a report and basically tells us exactly who's gone where, as far as how far they went into it, whether they opened it or whether they deleted it, whether they clicked on the link, and then ultimately, once we find those results, part of it is doing some training on looking out for those type of things and being very vigilant of emails that are suspicious and what to look for. So that's part of what we do, and we're seeing on the regular, as we do it more often, as we do these phishing campaigns more often, the number drops. So that's something to definitely consider. Incident response and business continuity plan. So have those in place. If whether the disaster is ransomware where it encrypts your data and you have to restore it, have a plan in place that says if that happens, this is what needs to get done, and here's how the people are going to get affected, and here's how we're going to respond to our patients and to our staff. Having something in writing goes a long way. And the big thing for me is it's that what I share with our is this is an ongoing thing. It's not just you kind of set it and forget it. It's an animal that keeps growing. It's one of those things that you got to keep testing, because it's just not IT, right? It's your phones. What if your phones go down? What exactly do you do as far as that's concerned? What happens if connectivity goes down? It might not be an outage where your systems are down, but you can't connect to the other office for whatever reason. So what do you do in that place? So it's an ongoing thing, and it's one of those things that it's a never-ending process. It's just a matter of updating it on a regular basis. Understanding data, what's sensitive and where it lives. So understanding what your mission-critical applications are, where they sit, and what's the best practice to ensure that you're, again, backing them up and that they're performing up to par. So it's important to have a good understanding of the data and what exactly it's doing and where it lives. Review your practice management and EHR audit logs. Again, this is a part of the best practice, is to do it incrementally to see who's accessing patient records, if it's in line with your policies, and if it's not, then you can adjust accordingly. But it's something that we highly recommend doing on a regular basis. Providing ongoing security and compliance education and training. As you can tell, this has been a theme during this conversation today. Whereas we see that education is the biggest thing that we know and we truly understand that's going to help the organization, is by educating your staff and training them. Establish and maintain compliance and security policies and standards. Again, those are things that it's not one of those, set it and forget it. It's an ongoing thing. So having the right people in place to understand that you have these policies and standards in place is important. So whether it's a third party that you're using or whether you're doing it yourself, my recommendation is to stay on top of it. Develop process to audit your rules. So you have certain rules and certain policies in place. Are you auditing them? Are you to make sure that those make sense? Do you need to make changes? Because as the organization grows and changes, you might want to take that into consideration. Implement physical security controls, whether it's accessing the building and you use access control systems, and those access control systems should have some type of electronic way to audit who's coming in and out of your building. Same thing with video. Be careful with video, though, because you have to take into consideration if you have patients coming in and out and their privacy as well. Encrypt mobile devices, whether you're using a tablet or if you're using a laptop or a phone. Understand that any data that you're transmitting back and forth that has PHI needs to be encrypted. So using the right tools in order to do that is very important. Confirm that business associates are following HIPAA rules and guidelines. And like I said, the best way to do it is just ask, can you share your HIPAA security compliance guidelines, and what are you doing? How often are you training your staff? Because technically they should be going through the same type of training that your staff is going through. Any of the business associates should be going through that as well. Keep up with the changing rule, regulations, federal, state, and accreditation. This is a tough one as these rules keep changing, but having someone, a trusted vendor that can really provide you that support is important. That's also something to consider. Okay, so let's go into supersizing cybersecurity investments. And here's some information regarding what it costs you per incident, to secure a patient's record, and what it would cost you if you were to be breached and the cost incurred of that breach. So they're saying a preventative cyber cost it's about $8 per patient record, where if the estimate cost of a major breach, if you don't have something in place, is $200. So it's a pretty dramatic delta between both of them. So and making investments in security or having something in place, or even looking into it, trying to understand where you are is imperative. Prepare for cyber intrusion. That's, increase IT budgets that take preventative measures, plan ahead, and how to respond to a breach, involve the vendors with access to the data. So it's understanding your environment and what you need to protect, and understand how well is it protected. What tools do I have in place? What countermeasures do I have in place to protect myself and my organization? Building strong data security and breach prevention systems. So having something in place that's detailed, that you understand what needs to be put into place. And a lot of that has to do with really understanding your environment and understanding those gaps and having a remediation plan for those gaps and whatever tools that you can use in order to address them. Have crisis management strategy in place. So if you do get breached, who do you call? Who's the first person that you call? And after that first person, then who do you call? So there's a chain of events that need to happen, and do you have something in place now to help you with those chain of events? Vendors need to share responsibility for security. I'm 100% agreed. Whether it's your IT vendor that's accessing your systems, and being able to hold them accountable. So ensuring that they have, or asking, make sure you ask the questions of what are they using and what do they have in place in order to ensure security. We do a lot of remote access to a lot of our client systems, and we're using dual authentication and high encryption between those connections. So that's what we use. So it's important that you ask those vendors that have access to PHI what they're doing, and hold them accountable for security. So again, it's more of a, we keep emphasizing on some things here before security risk assessment. I think this is the first thing and foremost that you should do, because this will give you an understanding of where you stand and what you need to get done. Ensure you have business class firewall in place. Again, that firewall is the gateway between your organization and the outside world. Having a business class firewall is what you need. Understand, that you can have a firewall in place, but it may be it may be discontinued. Firmware is not up to date. With the evolution of cyber crime, it's important to have something that can be updated on a regular basis, that's easy to manage, so that if something occurs, it can be easily updated. So that's part of what we look at when we identify a solution. Web filter, when we talked about that, it's important to have the ability to filter any unwanted web traffic within your organization and be able to report on it, to understand what your staff is trying to get to and not to get to. So having web filter tools in order to prevent that is definitely something to consider. Use strong processors with quarterly resets. I can't tell you how many times we've gone into part of our risk assessment is to sit with some of our administrators and have a very candid conversation and talk to them about their family and their friends and their dog, and I'll have them lock their computer, and I'll go into their computer and I'll try their dog, the name of the dog, or their kid's name, and I would say 80% of the time I'm able to get in. So it's important to have certain characters and deviations of certain passwords. I know it's a pain, but this is the world that we live in, and it's about adjusting. Standardized endpoint security solutions. So if you have endpoints, security solutions. So in other words, software that sits on your computers and on your servers that are protecting you from viruses or malware. Make sure it's standard across the board, that you don't have different versions of it or different types. Part of what we do is that's part of our offering in our managed services program, where we offer to all our clients. We manage it. It's on us. Obviously, we have skin in the game, so we want to ensure that it's standard across the board. So we know that that's the case. So managing endpoint security, and that's different. It's just makes it a nightmare to manage, and at the same time, the risk of intrusion is higher. Dual authentication is something that we are highly recommending as well. Nowadays, if you're accessing your systems from the outside and you just, you're probably just going to a website, putting in your password, and that's it. What we're doing with some of our clients is we're using dual authentication, where you log in and it's going to send you a email or a text to your phone, and it's going to ask you to enter those numbers or whatever type of the authentication message to say who, to confirm who you are by doing it that way. So it's just another way to confirm your authenticity. Ensure that your operating systems on your servers and on your desktops are up to date. So patch management is important. Enabling multiple device encryption, as you can tell, this is a common theme. Systems monitoring, getting the understanding that those monitors are in place, and that you're gathering those event logs. User monitoring, understanding what your users are doing. verify and confirm disaster recovery and business continuity plan. Again, this is one of those things that, you know, it's not a set and forget it. It's one of those things that you got to continue to do and test it on a regular basis so you can adjust. I'll skip this video. It's a video that we did. Actually, we went on the streets to ask some people what they thought about security. If you go to our website, it's our YouTube channel, you can do it there. I'm going to open for questions. So if anybody has any questions, I want to thank you for your time. I did want to also share that we are performing a night at the races that is sponsored by Data, who's our disaster recovery partner. And we're going to be talking about cybercrime and cybersecurity and some of the things that we're doing in order to prevent that. There's still some space, so if you want to register, you can definitely register. Just go to our website and this link, and it'll take you there. One other thing, don't forget, PMC 2017, we've been going to it for the last 5 years. No, I'm sorry, for the last 10 years. We're going to be there. We are going to have a we'll be sending out some invitations to our pre-conference reception, which is a hit. Everybody has a great time there. Come and say hello. We're going to be sponsoring the Cyber Cafe, which we have a barista there. It's going to be serving out some fresh brew coffee for everyone. With that said, I'll leave it back to the folks at MGMA for any questions.
If anybody has any questions, you can type them in the question box. We'll just give it a few seconds. It doesn't look like we have any questions coming in.
Okay, if we have some, do we still have some time?
Yeah, you have a few minutes.
All right, so I can put on this video. Let me see if I think I have it up. If not, I'll put it on real quick. Cybercrime is plaguing healthcare in the United States. It's a growing epidemic, predicted to affect 1 in 3 Americans and cost $6 billion annually. How concerned should you be about healthcare data security? We took to the streets to find out the public's opinion regarding patient privacy, and here's what they had to say. What expectation do you have of your doctor protecting your medical information?
I would expect them to keep it secure. That's my expectation, because I fill out forms when I go to the office, and I expect them to be within that office and given to no one else.
How would you feel if you found out your medical information was lost or stolen?
I'd be pretty upset and angry, because isn't it their job to make sure that everything is confidential?
Yeah, without a doubt, I definitely feel betrayed, and I wouldn't want to go back.
Did you know that the government takes an online wall of shame that lists organizations with breaches of unsecured patient health information?
A wall of shame? That's disturbing to know. That's what you pay them for, to protect your information.
What would you think about a doctor if you learned he or she invested in security measures that help protect patient information?
That'd be great. I mean, it shows that they really care about their patients and that they're making the investments to protect your personal information. I mean, actually, I'm going to ask my doctor when I go back to see what they're actually doing to help protect what I have invested in them.
We met with healthcare professionals, the people patients most trust to maintain privacy. And here's what they shared. Why does security and protecting patient health information need to be a priority for healthcare providers?
Number one, it's the law. Enforcement is up, penalties are high, and they really need to be aware of that. But if that's not the main motivating factor, patients are expecting their healthcare providers to protect their healthcare information.
How do you think the opinion of a practice would change if we were to lose patient information or if there was a breach?
I think that if a practice breached information or any information got out, it would be devastating to any practice, large or small. Patients expect great care when they come to your office or your practice or your surgery center, but they also expect their information to be safe.
Doctor, what responsibility do you feel physicians have to protect patient medical information?
I think the physicians have a very important responsibility to protect the patient's information because it builds confidentiality between us and the patient.
What are some of the IT security measures that providers should be taking into account?
The first one is to do a security risk audit. Along with that, though, they should do a vulnerability scan to make sure that all of their IP addresses are secure, and they should also be doing a penetration test. And they want to make sure whoever is doing that is qualified to do that. And once you've done it, you want to do it on some type of regular basis.
So if you had one piece of advice to give fellow administrators in a practice or in a surgery center, what advice would that be?
The advice I give to any administrator or practice administrator, number one is to understand HIPAA. Make sure your employees understand HIPAA. And make sure you use the right IT partner, such as Priority One, to be able to use all the tools that you have to make sure that their information is safe.
So what recommendations would you give out to other physicians out there, Doctor?
One is you should always have written guidelines within the practice. You should have a compliance manual. You should have a physician champion who takes charge of HIPAA regulations, changing guidelines, and a very good HR department who can funnel this through to the practice. Not only that, you need the best resources with an IT facility and company that can protect everything within your practice as if it were their own.
Hi, I'm Nelson Gomes. Patient privacy and security is our priority one. Contact us to learn how we keep your patients from being a cybercrime statistic. Technology means simple. Imagine that. All right, so with that said, that was a shameless plug. I think that there was a lot to be shared, and I went through a lot in a short period of time. So I'm done. Thank you for your time. I'm hoping to see many of you, all of you, at PMC 2017. It's a great event. If you haven't registered, you need to register. They throw on a great event, and we look forward to seeing you there.
Thank you, everyone, for attending, and thank you, Nelson. The presentation will be emailed out this afternoon.